need a health plan that fits you better. Get Manulife Health Flex. Choose from 4 health bundles to get coverage for cancer, heart attack, stroke, and over 100 other critical illnesses.
Build it yourself to get just the right benefits, so you can start to make every day better in your own way.
Find healthy that fits you perfectly. Ask your insurance advisor about it. You need a health plan that fits you better. Get Manulife Health Flex. Choose from 4 health bundles to get coverage for cancer, heart attack, stroke, and over 100 other critical illnesses.
Build it yourself to get just the right benefits, so you can start to make every day better in your own way.
Find healthy that fits you perfectly. Ask your insurance advisor about it.
While waiting for a program to start, may we invite everyone to answer our poll questions flashed on your screens right now.
Good afternoon, everyone. I'm Luis Manzano. I'm happy to join you once again in this afternoon's wellness webinar brought to you by a leading global life insurance company, Manulife Philippines. Last time I was here was the start of 2021, and now we're halfway through the year. So gusto kong kamustahin ang inyong mga New Year's resolution. Did you guys stick to your diets? Success ba yung mga balik-alindog programs ninyo? Achieve na ba ang inyong mga financial goals? Well, if you're going to ask me, well, I definitely stuck to my resolutions dahil I am now officially married, and I'd like to think that I'm working to be the best husband to the best wife ever. At kita niyo naman, kahit ang daming nangyayari, medyo pabata ng pabata ang aking itsura. But all jokes aside, being healthy and maintaining our well-being takes a little more effort during these uncertain times. Alam natin that more than a year into this pandemic, many of us continue to face challenges that cause us stress and anxiety. But one of the biggest lessons that we can learn from this pandemic is the importance of being healthy both in mind and in body, because health matters. In fact, nabalitaan ko we have more than 3,000 attendees. So thank you very much, and we hope you have fun. Now, today is a webinar about caring for your mental and physical well-being. But before we continue with the program, let's look at the audience pulse for our poll questions earlier. It is nice to see that our audience today is very interested in this topic. Now, for our first question, it was, which of these illnesses are you most fearful of? Let's see the results. We have cancer with 56%, heart attack with 34%, and stroke with 10%. So top of that is cancer. Now, all these illnesses, all these three illnesses actually are very serious. Now, treatment and medication may greatly affect the person physically, mentally, and financially. Now, we will be joined later on by a subject matter expert to discuss more about this. And for our second question, how do you maintain your well-being during the quarantine? Let me see. Taking the top answer is staying active with 36%. Followed by, actually it's a tie, healthy diet and connecting with others, 30%, and meditation gets 5%. Now, as the World Health Organization expressed, the pandemic has gone beyond affecting physical health alone. Mental health is also part of the crisis. And today we have invited someone to enlighten us about the emerging mental health issues, coping and making every day better during a pandemic. He is the chairman of the Department of Psychiatry and Mental Health in Quirino Memorial Medical Center. Please welcome Dr. Edgardo Tolentino Jr.
Thank you so much, Luis.
Hi, Doc.
Hi, good afternoon, and good afternoon to all who have been attending this afternoon's health webinar. Thank you very much, Manulife, for putting emphasis on the mental health side of the impact of this pandemic. And I have entitled my talk, Reigning in Control of Our Lives in the Pandemic, precisely because what if we put as a central theme, the main thing that we have lost as a result of the pandemic, it is control of our lives. We lost control of the structures. We lost control of our schedules, our boundaries, and we lost control of the predictability of our lives. Allow me in the next slide to show you, for example, what the social weather station has actually shown in their national mobile phone survey. And as you could see, they did a serial of surveys, one in May 2020, in July, and then in October. And they segregated the responses into how people are feeling either great stress, much stress, or those with little or no stress. As you could see, it is the minority of Filipinos experiencing little or no stress throughout May until October. As you could see as well on the left and in the center, most Filipinos, from 89% in May to 86%, still quite high, and still the majority of Filipinos experiencing great or much stress in this pandemic. You could just imagine what it would have been if they did a survey also in the recent surge. Next slide, please. Now, this pandemic has also been called the echo pandemic or the parallel pandemic. and this is on mental health. And the different researches worldwide, and this is not just local, has shown based on what's happening now and in previous economic downturns, number one, job loss is associated with a lot of things: increase in depression, anxiety, stress, and also it does affect self-esteem, which could be lowered. And it also could lead, and this is an important thing, and I think this is happening in our own country, increase in the rates of substance use disorder as well as suicide. During the pandemic, also, adults, particularly in households with job loss or lower incomes, report higher levels of that stress. 53% against 32% of households without much loss of income. Also, borrowing from existing research on the different pandemics occurring around the world, and both in the past and in the current COVID-19 pandemic, there's major concern around poor mental health and well-being, particularly for children and their parents, especially mothers. And I'd like to put emphasis on that, as many are experiencing challenges in the school closures and the lack of childcare. Women with children, especially children below 12, are more likely to report symptoms of anxiety as well as depressive disorder than men with children, from 49% of women compared to only 40% of men. Still quite high, if mind you. And in general, both prior to as well as during the pandemic, study after study in different countries, for that matter, women have reported higher rates of anxiety and depression compared to men overall. Let's go in the next slide to a local study which was reported out in the Journal of Affective Disorders. And this is looking at the psychological impact of COVID-19 pandemic in the Philippines. So let's go for the results in the next slide. In general, we could see that as a total, 16% of respondents rated psychological impact of the outbreak as moderate to severe. 16.9%, practically 17%, reported moderate to severe depression, and a little less than a third of the population studied, 28.8%, reported moderate to severe anxiety, whereas 13% reported moderate to severe stress levels. If we segregate what could be reported as the risk factors for developing more mental health issues, being female, as I mentioned, study after study from China to Italy to other European and Asian countries and the Americas, constantly report that being female at this time could be a risk factor of having more stress, depression, and anxiety. Also, being young, of single status, students in particular are impacted on their mental health. Those already with specific symptoms, for example, if you have had already a pre-existing anxiety or already stressed out from the get-go, if you had been recently imposed quarantine on account of perhaps suspicion of being positive, or for our young children below 18 and those beyond 65, the prolonged homestay. And I'll go back to that in just a while, because there is also a major implication both on mental and physical health for those on both quarantine and social distancing. Those with reports of poor physical and mental health, those with unnecessary worry or concerns for family members who they are scared that they may bring in the infection, and those who have been suffering from discrimination were significantly associated with greater psychosocial impact of the pandemic and higher levels of stress, anxiety, and depression. However, on the other hand, and this is in the next slide, I'd like to show that in researches now in psychiatry and mental health, we don't just look at risk factors. And in this particular study, they also looked into the protective factors. Why are some people less so affected, either in their mental health or even in their physical health by this pandemic? Well, those with adequate health information, having grown up children that they don't have to more closely look after, having a perception of good health status and confidence in doctors' abilities because they they have the backing, or they have a good, for example, health status or insurance for that matter, so they don't have to get worried if in case they do get ill. This is associated with lesser psychological impact of the pandemic, as well as lower levels of the stress, anxiety, and depression that we saw in those with higher risk factors. Also, practicing good health and safety protocols like hand washing, using face masks, etc., were also they had a positive impact on the psychological health. The restriction on social mobility to control the pandemic is indeed stressful, as it prevents face to face connections. And this has become a major issue, especially in our young and working people. And it has prevented the traditional social interactions. Now, those who can, in fact, be able to go out somehow had lesser of the stress. So it was helpful that they interacted, for example, doing face to face work. Now, let's move on to the next slide. There is also, and something that I need to highlight, is that there is a generational divide in how different generations are responding to this pandemic. And this is based on a Harris poll of around 2,000 individuals. Mind you, this was done in March 2020. So this was not yet the height of the surges in infections. And in this particular poll, they found out that 77% of adults who are over 65, these are baby boomers, as well as 67% of millennials. So you're a millennial if you were born between 1981 to 1996, said, and I quote, they are unlikely to catch the virus. And this, despite at this point, I just updated my data. There have been, as of June 6, 173 million plus infections and as much as over 3.7 million deaths already. And we do know this, that in parts of the US, for example, during the spring break, a lot of kids, college students, went out into the beach and the bars, uh, pushing further the surges. The baby boomers, there's an explanation for this. Those born between 1946 and 1964, and those who are older, may have already a lot of experiences with crises that they have undergone. And their attention is clearly not so much on themselves, but perhaps on their grandchildren or their adult kids. But for the younger generation, the millennials in particular, they tend, as their way of defending from stressors, etc., they try to stare down on problems. In a 2018 survey by the American Psychological Association, they also found that Gen Zs, these are the younger batches, are most likely of all the generations to report poor mental health. However, there's a silver lining here because amongst all these generations, it is the millennials as well as the Gen Zs who are more open to seeking mental health help. So we move on. I wanted to highlight because we are one of the countries with the longest over 370 or 380 plus days and counting of isolation and quarantine. What is the consequence of that? According to the Journal of the American Medical Association Psychiatry, they found out that this combination of physical distancing, the economic stress brought about by the downturn in the economy, the barriers to being able either to seek or the availability of mental health treatment, and the pervasive national anxiety on account of this very scary pandemic, a once in a lifetime experience, is the perfect storm for suicide mortality. And in different countries, including ours, we have seen already a rise in suicidality. Also, specifically for social distancing and isolation, I attended a recent European convention and they did a meta analysis. They combined a lot of studies to power up the conclusion, to be able to conclude. And they found out, and this is quite interesting, that those two factors, social isolation and social distancing, this lack of social connection heightens the health risks equivalent to as much as smoking, as much as three-fourths pack of cigarettes every day, almost daily. So, and this is borne out by other researchers because, in fact, there is robust evidence that social isolation and loneliness significantly increases the risk for premature mortality, and the magnitude of the risk may even exceed that of many leading health indicators. So it's very important to mind that because we do still have our old parents and our very young kids who have remained socially distanced and isolated. Now, I want to move on the next slide, to something more positive. And that is, what can we do? How do we rein in control during this crisis? Next slide, please. Bottom line is that when we all talk about seeking help or reining in control, it has to be on a multi-dimensional point of view or perspective. We start with ourselves, the individual, doing self-care. Then we mind also the systems where we're in, our organizations, our societies, our clubs, if any, our neighborhood or our community, and then the bigger society, so that together we could all heal as one. And inside any of these programs or interventions, necessarily there is it will help to have training, for example, in resilience. I'll talk about that in just a while. Stress reduction, doing all sorts of either meditation, simple breathing exercises, and emotional awareness, which is something that we need to actually inculcate within ourselves, and the different self-care strategies, which I am just about to talk about in the next slide. So how do we care for ourselves? We could only care if we start out by trying to understand how we are feeling about things. So feel free to feel your feelings. And uh, as we experience that, it is also important to intentionally look for and employ deliberately coping strategies. Whatever worked before is certainly going to work again. This is the same way that you could help others. Start off with asking, how might you be feeling about what's happening to you? What have you tried as your own way of coping? This empowers them. This is reigning in control. And because of the nature of this pandemic, where we have constantly ups and downs, new surges, new challenges, etc., we need to perform regular check ins within ourselves. How am I feeling now? What am I doing, or what can I do to be able to handle the situation? Very important, because one of the key factors early on that they found to be something that's causing a lot of stress would be all the news and social media, especially if they come from unverified, unscientific sources. So it may be important to take breaks from that too, or those who are working from home, take breaks also from your digital gadgets. Okay. And at the end of the day, very important as part of self care is gratitude, kindness, empathy, and the knowledge that the little things that I do are important, and they have meaning for me and for the people who are significant to me. Allow me in the next slide just 10 tips on how we can build resilience, because after all, we this may not be the last, knock on wood, but this may not be the last challenge or adversity that we might face. It's important to build resilience. First is making connections, and in as much as we need to cultivate relationships, it is important as well to be able to accept help and also support when we do need it, especially in the context of mental health. Um, Also, part of that is supporting others when we have the means to do so. Second is, of course, self discovery. And we've had a lot of chances during this pandemic to do some self discovery of our self worth, knowing what our strengths are. In this pandemic, a lot of us have learned some new skills, new talents. Some have even come up with new hustles. Then, third, in terms of building resilience, is making sure that we accept and be able to manage change, because change from our birth has been occurring, and we need to go and accept and constantly deal with the changes that we undergo. Fourth is keeping things in perspective. We should see the broader picture. We are, in fact, running a marathon. This isn't a sprint. And it's important that we focus on just being able to do this step, next step, etc., so that together we could all finish this marathon together. Then, fifth is taking decisive actions. And this would mean adapting a solution mindset, which is, if we are faced with adversity, we look at our options. Option A, pros and cons. Option B, pros and cons. What would be my best option? And that leads us to the sixth, which is moving towards our goals. And that would mean using goal setting techniques and strategies. What would be the best to do? And as you move towards your goals, assess, measure where you are, look into your outcomes, Do not forget, celebrate small and big victories so that you could affirm yourself. And talking about affirming, we move to nurturing our self esteem. And by the way, which is probably something important amongst us Filipinos, we're not used to saying no. Saying no is actually nurturing our self esteem. It is honoring ourselves. When we can't do it, it's okay. It's okay to say no. So develop our self assertion, okay, which will also redound to better resilience. And during times of adversity, the next is quite important. We need to constantly maintain hope as well as positivity. This means that we need to constantly, on our day to day, nurture optimism, enthusiasm, and visualize our goals. Why am I doing what I'm doing? And second to the last, we need to nurture take care of ourselves, meaning body, our mind, body, mind, as well as nurturing our soul. And finally, it is important that we see all these challenges, all these adversities as surmountable. After all, the world has seen a lot of other pandemics, and here we are. We still survive. We now have the vaccines. Hopefully, this gives us more hope that we can, in fact, in the very near future, lick this other the COVID-19 vaccine as well, COVID-19 pandemic as well. So for those who are staying or working at home, these are some of the mental health tips on the next slide. First is we need to be able to schedule unscheduled time. We have freed up some commuting time in the morning as well as in the afternoon. We can very much use that either as having, a leisurely cup of coffee virtually with our colleagues, which we can't do anymore, just to connect with them and to actually cue us that we are starting our day. Second is defining our boundaries because in fact that's one of the things that we lost. Our homes have also become our workplaces, and it's quite important to define very clearly where's your workspace, where's your eating space, where is your leisure space, as well as your sleeping space. And it's very important not to merge those. It will get confusing, and it actually helps the other people within the household to cue them that if I'm, for example, on my desk, on my work desk, that I am doing some work and I am not to be disturbed. Also, very closely related to that is putting structures. And by structures, I mean separating the actual work time as well as our leisure time, as well as our eating time and our sleeping and waking up time. That's very important. And again, as I started off, we talked about reigning in control. This is one way by which we could put some normalcy in what has happened to us. And finally, if you're working from home, take a break, take a digital break every so often. I make sure, for example, as I do my teleconsults after every patient, if even if I had less than 5 minutes, I'd stand up and walk back to my computer. Now, moving on, there's so much to look forward to, and as we look ahead, the pandemic, as we know, has both short and long term implications for mental health as well as substance abuse, particularly for those who are already at risk of either new or they are exacerbations of already existing mental health problems. Based on history, previous pandemics previous economic downturns, the mental health impact of disasters will outlast that of the physical impact. This suggests that today's elevated mental health need will continue over a long time beyond this particular pandemic. If we are to borrow from what the experience of the SARS pandemic was, 3 years after, there were still people suffering from the psychological trauma of SARS, and that wasn't as bad as the COVID pandemic. Also, the financial crisis that has been accompanying this pandemic will have a significant implication also for mortality due to deaths of despair, which is suicide. And we see that happening already. It will be important to consider how all these increased risk for mental health and substance use services will likely be a long term, and it will persist over that time. And even if new cases and deaths due to the uh, coronavirus subside, there will still be need for more mental health services. And to end this, I'd like to remind us in this slide, in the new normal, resilience is not the ability to bounce back, but rather the ability to bounce forward. We will not go back to the way things were. Everything is going to be different going forward. And in this marathon race, we will all cross that finish line with new thoughts, new feelings, and new approaches to the way we live our lives. So thank you, and back to you, Luis.
Thank you very much, Dr. Ed. That was such an insightful talk about mental health. If you have questions for Dr. Ed, please feel free to type in your questions in the Q&A box at the bottom of your screen. We'll see more of Dr. Ed later during our Q&A session. As Dr. Ed touched on earlier, it is very natural to feel stress, anxiety, grief, and worry during these trying times. But it's important that we manage these emotions because it can also lead to physical health problems or critical illness. According to a recent study done by Manulife, contracting a critical illness and being a burden belong to the top 10 list of what Filipinos worry about. To discuss more about common Filipino illnesses, the cost of medical treatment and maintenance, joining us today is the former president and CEO of Makati Medical Center, all the way from Spain. Please welcome Ms. Rose Montenegro. Yes, you are, Ma'am Rose.
Yeah. Okay. I'll just put my timer to make sure that I'm okay. Yeah. Thank you again for this kind invitation. I've been retired for going on 3 years, and so it was a welcome break for me. If you see, I use the term jubilada, which is the Spanish term for retired. I like it because it suggests jubilation, joy, action, as opposed to the English word retired, which seems to suggest passivity and that you're just in hibernation and isolation. I guess that's one way of using positive thinking in today's environment, right? You choose a word that makes you feel better. Okay, so health matters indeed. COVID-19 has highlighted that it respects no age. I think the slide has moved ahead of me. Yeah. It respects no age, no boundaries. Because of that, there is a heightened awareness for us to want to stay healthy. We want to avoid getting COVID, and not just COVID, but all the other comorbidities that normally exist, even during normal times. Okay, so we have to understand the costs. We have to understand the medical costs, the professional costs, which could result in financial ruin and result in greater mental health disorder because of your worry. If you don't have a job and then you get sick, then you have to think of going to the ICU. How much are you going to have to pay for all of this? So we have to make sure that we are aware of it and we make informed decisions, okay? So the next one is the presentation path, which is self-evident. You missed the presentation path, but that's okay. So I'll go to the big picture first. I just wanted to share with you the population of the country. Even mix between men and women, 50-50, okay? Close to 50-50. The annual population rate is self-evident. Life expectancy, the women live longer than men. And you know what? It is universal. On average, women outlive men by 5 years in all the countries that I researched on. So the question that begs to be asked is, are women causing men to die earlier? That's a thought, right? Okay. Now, I want you to focus on the lower portion of the slide, the per capita income, because this is very important. We're only doing 3,850 per annum, which is already a significant improvement, but put in context, the US has $66,000 per annum, Spain has $42,000, Japan is 40, Singapore is 65, India is below us at $2,100 per annum, because the wealth of your nation, the per capita income, determines the level of healthcare that the government can support you with. So you have to be brought back to reality that you cannot expect healthcare of developed countries where, for example, I'm in Spain, everything is, we have universal healthcare, it's free. It's really very easy. If you get sick, you don't have to scramble and think of the costs. But remember, a country as rich as the US has 30 million people who have no insurance. Let me repeat that. The population of the US is 328 million, and 30 million of them are uninsured because Americans don't want universal health care because they consider it as socialism. I think somebody has to teach them that socialism is not communism, and socialism actually works for Europe, Australia, and Canada, especially where healthcare is concerned. So the country with the highest, longest, the best longevity is Japan. The average 80, the men die at 81 versus our men dying at 71. Women die at 87 versus ours dying at 75. Next slide, please. Okay, look at the income distribution. The poverty level in the Philippines is still 16.7%. Significant improvement compared to what it was during the 1980s at the height of the Marcos dictatorship. It used to be about 40 to 50% already. The great news is the middle income has improved to the middle class is now at 40.5%. But very disturbing is that there are only 1.4% who belong to the upper income. That means we haven't really moved. So that if you look at it, the wealth is controlled by a small group, and it doesn't really trickle down to the lower income of 58%, who are 58%. Now, again, to give you perspective, I read an article recently that said the top 5 richest Americans control the same amount of have the same amount of money as the bottom 50% of Americans. That's a staggering statistic. These are Elon Musk, Bezos, Jeff Bezos, you have Bill Gates, you have Zuckerberg, and you have Warren Buffett. The 5, their net worth is equal to 50% of the American population, which is over 150 million. So the US is beginning to follow our trend, whereas in the past, the income disparities were not as great. Now you're seeing it, and it is very obvious in healthcare. Next slide, please. I just wanted to give you examples of their types of hospitals. You have the public hospitals and you have government-owned hospitals. It's very important to know which are the government-owned hospitals, because if you cannot afford the private hospital charges, then it is good to know that which hospitals you should approach. Now, some of the best-run government hospitals, I have to say, are NKTI, National Kidney Health Institute, the Heart Center. These are 2 very well-run hospitals that even look like private hospitals if you visit them. Next. The healthcare providers, this is very sad. In a country of 111 million Filipinos, We only have close to 41,000 doctors, and most of them are concentrated in Metro Manila. So there is 0.6 doctor for every 1,000 Filipinos. Nurses are a bit more at 127,000 or 1.69 nurses. But again, these are concentrated in Metro Manila and major cities in the country. We have dentists too, but they have independent practices and they normally are not attached to hospitals. Other healthcare providers are your med techs, who take your blood when you do laboratory tests, your rad techs who do your radiology, all kinds of imaging, all kinds of diagnostics. You have your physiotherapists, you have your occupational therapists. The sad thing is these are the ones who leave the country because the salary scale is very low until today. When I first joined Makati Med in 2009, I was shocked that the nurses were earning less than the CSRs in the call centers I used to run for PLDT. So they were earning something like 12,000 a month to 15, and whereas the call centers were already doing anything from 20 to 25,000. So one of the first things I did was to increase the salaries of the nurses. We entrust our lives to them, and yet we don't want to pay them well, okay? More importantly, we see the nurses the most. The doctors will come in and out once in a while when you're confined, or they'll send their residents, not necessarily them, but the nurses are the ones who are with you every step of the way when you're confined. Next, please. And then you have, I'm sorry, you have informal caregivers, the arbularios, the manghihilots, the faith healers. You know, when you're sick, you'll go anywhere, you'll do anything in order to regain your health. Next slide, please. Okay, you forgot. Okay, I'm sorry, but I think the sequence of my slide has been changed, okay? So you're talking about the top 7 causes of morbidity in the Philippines. It's cardiac arrest and cancer. And that dovetails with what you said in your survey today. Cancer is really growing. The most vicious cancer is lung cancer because it affects men and women. And there are 2 types, the ones from smokers and the ones who get cancer from passive smoking. Next slide, please. Okay, whoever branded my slides to be Manulife managed to rearrange it, but never mind. As Dr. Ed Tolentino, a friend of mine from PLDT, from Makati Med said, resiliency. So I will be resilient. As I said, higher health consciousness with COVID-19 now, and what you have to remember is that the existing life goes on, and so do the existing diseases. The threat to one's life continues. Just because there's COVID doesn't mean you're not going to have a heart attack, okay? Anxieties and fears about not just getting sick are there, but also about how do I pay for the expenses. Next slide, please. These are what are available to you. You are all very young, so you don't have senior citizen discounts yet, but you have some people with disabilities also get the 20% discount, okay? PhilHealth, which is the government insurance system, pays for about 10% of your healthcare costs. That's because, remember, again, we're a poor country. Your per capita is 3,850. You cannot expect your government insurance system to fund everything. PhilHealth mostly supports inpatient, but now they've come up with new outpatient subsidies for dialysis, chemotherapy, radiation therapy, endoscopy, and even cancer. Next slide, please. HMOs, there are about 28 serious players in the country, and I understand Manulife has a health insurance product, which somebody else will be talking about in a bit. But what is interesting is the top 5 HMOs control 85% of the volume. If it is not a complex case and you have HMO coverage, it will cover 100% after you have your PhilHealth and after you have your senior citizen discount or disability discount. They will cover 100%. So be very, very savvy about choosing your healthcare provider. Corporates give healthcare as a benefit, but it is based on rank. They're self-insured, which makes it very expensive. And that's why companies like PLDT are trying to move away from being self-insured because of the costs. But then the rest will be personal and out-of-pocket expenses when you have a serious case that's complex, critical, and you have existing comorbidities. Next slide, please. Discounts, that was the favorite word that was given to me when I was in Makati Med. The hospital, I would hardly give discounts except for the poor. I would always tell the patients to ask the discounts from the doctors because the doctors don't have fixed costs except for their clinics, whereas a hospital has huge operating costs. PCSO, the Philippine Charity Sweepstakes Office, used to give a lot of support, but of late, with changes in government, they've stopped giving. In the past, they would give 100,000 support just like that, and they had a PCSO clinic, PCSO desk in Makati Med, so you didn't have to go to PCSO unless it was for a higher amount. They would even give, the highest I ever saw was 500,000. I checked with the CFO of Makati Med today, and they said PCSO has really been dampening any of these assistance, and you have to go through hoops and hurdles in order to get any support from the PCSO. Foundations of major corporations also provide medical assistance, but it really depends on who you know and how you're affiliated with that particular foundation. Lately, crowdsourcing is also becoming popular. You go to Facebook and say, you need to raise funds for a certain person who is seriously and critically ill, but does not have enough finances. Next, please. This is just for your information. You can read it, okay? The types of confinement. Inpatient in the Philippines is still an average of 4.5 days. To let you know, in developed countries, it's only 2 to 3 days, with exceptions, of course, for very serious and complex cases. But what I want you to learn, if there's any takeaway that you get from my presentation, is that don't be ashamed to ask your doctor for the price up front. For some reason in this country, we're ashamed to ask doctors, how much is it going to cost, doc, if you're going to operate on me? It is imperative that you ask for the cost so there are no surprises. It is also imperative that you go to the hospital and ask them for an estimate for the procedure that you're about to have. That way, there are no unpleasant surprises and that you can prepare. You can prepare for the expenses. The other thing I want you to understand is, in the Philippines, unfortunately, many of our doctors still say generics are not as good as branded. That's not true. The definition of a generic drug is a drug whose patent has expired. So major pharmaceutical companies spend a lot of money on research and development, come up with a very good product, for example, Viagra, but when the patent expires, all the other pharma companies can begin compounding that particular medication, and it is as effective. As a matter of fact, in Spain, when you go to a doctor here, they will give you the generic first. And then you only get the branded when the generic is not available. Very different mindset. In the Philippines, they always put the branded and they will say, oh, it's not as effective. Don't believe that. It is equally as effective. Pharma prices in the Philippines are also one of the highest in the world. And that's because their cost of sales is high because they do a lot of things for doctors. Which I shall not get into great detail because that is very contentious, okay? You should also go to standalone diagnostic centers for your lab and your radiology, and this is coming from someone who managed the hospital. They have the same machines as we do. For laboratory, they use Abbott or Roche. They use exactly the same things as we do. Unfortunately, if you're an inpatient, it is hospital policy to only use the lab results and the radiology results coming from our in-house, because they say that's the best way to protect the quality. But if you do research, the medical equipment used are the same. And they also have pathologists. Next slide, please. Costings, I just wanted, you can read this. It shows you what PhilHealth is already supporting. If you have a heart bypass, I noticed that heart attacks are a big source of worry for a number of you guys. if you have a bypass, PhilHealth will give 500,000 to cover that. Strangely, for angioplasty, which means they put stents, which is the first step before you have a bypass, they only give 30. I was trying very hard to convince PhilHealth that they should match what they're doing with the heart bypass. So if it's 400,000 for angioplasty where you have stents because you have clogged arteries, they should pay 200. I didn't quite succeed because I left 2 years later. So this one is self-evident. Next slide, please. I wanted to give cancer as an example. Go ahead, since we're running out of time. When I first was trying to understand cancer, which is 56% of your concern, surgery is you cut, in layman's terms, radiation is you burn, chemo you poison. That was how it was explained to me by our head of radiation, our head of radiology in Makati Med. And he says you do a combination of the three, and it's no longer sequential. Normally, they want to shrink your tumor so that when they do surgery, the opening is not so big and it is easier to close. Also note that 13 out of 100 Filipino males will have cancer if they reach 75 years old. I think that was a typo. I think it's even 65. People are getting cancer at a younger age nowadays, and it is projected to increase annually. The cancer rate is projected to increase annually at the rate of 7%. Next. Just to give you an idea, in Asia, it's really lung cancer for the men because of the smoking, but for the women, it's number 3, and stomach cancer and liver because of the drinking. So it's lifestyle related. Next. There are some misconceptions. Historically, hospitals were run by charitable institutions. They are what is considered the best gift of the Catholic Church to the world. They operated all the hospitals. And that's why there is this bias in the country that, hey, why am I going to pay so much for my healthcare? You know, it should be free, or I should be given a big, big discount. Also, culturally, we always have this impression that I'm already sick and you're talking to me about money. Excuse me, don't you have any empathy, right? So I noticed when I was in Makati Med, if the patient was sick, he will say, I'll pay for anything. When the patient has recovered, suddenly they're questioning all the costs. And that is why you should ask upfront, how much is it going to cost? Patients demand the best care, and that's why they run to Makati Med, St. Luke, Medical City. But they don't realize that there's a premium. For example, if you want the best car and you want to buy a Mercedes-Benz, you will not be paying the cost of a Kia Pride, right? You have to understand, anything that is the best requires a premium. Not to mention that our doctors study anywhere from 14 to 16 years to become specialists. And they keep on studying in order to keep up with scientific and technological developments. And that is why they have to recover their costs, because the doctors, at the end of the day, are independent entrepreneurs. They're not employees of the hospitals. Hospitals are business corporations. We're here to make money, and we are highly regulated. Our margins are very thin, 8% to 15% if you're lucky. When I joined Makati Med, it was doing around 4%. 10% of the beds are also allocated for charity. You cannot give it to anybody else except charity. Aside from that, you have the senior citizen and the DPW discounts, which are shouldered by the hospitals and the pharmaceutical companies. We do not get any tax credits or support from the Philippine government. Okay, next slide, please. Latest medical equipment are also very expensive, and with technology exploding, what used to be something that you could depreciate over a period of 10 years, it's probably only 5 years if you're lucky. It's now gone down to even 3. Doctor's fees, as I said, or PF, as commonly referred to, account for at least 40 to 50% of your hospital bill. So it's not the hospital charging you the entire. If you're being charged 100,000, remember 40,000 of that or 50 will go to the doctors, and understand that they also deserve it because they have studied so long to become specialists and subject matter experts. Unfortunately, the Philippines follows the US model of healthcare. We go to specialists right away instead of going to family practitioners or general GPs. In Europe, in Australia, in Canada, you go to a GP first, and he will determine whether you need a specialist. And a specialist, often says, by definition, will cost a lot more than a GP. And a GP is trained to know which specialist you should be referred to. Also, people like to go to the ER. In Makati Med, we did a study. Only 20% of the cases are true ER cases. Patients go to the ER because doctors' clinics are closed at night, and they pay a premium of 30%. Now, we cannot also turn them down because that is required by law. We have to stabilize them, and they are a great source of bad debts. When I joined Makati Med, we had 500 million in bad debts because of the ER. Next slide, please. Changing landscape. So what are you going to do? How are you going to stay healthy, alive, live longer? Next. The traditional model is you go to the hospital because you're already sick. Then the interim model was you go to the malls where you have standalone diagnostic centers so you can reduce the costs, because traditional models like Makati Med had 19 specialties, 44 subspecialties, and sub-subspecialties yet. So you're supporting all of this, and sometimes you buy medical equipment that will not give you any return, but you need it in order to retain your image as this top-notch hospital. The new mindset is, please help me to remain, please help me manage my health, please help me to be healthy. Next, please. So the Harvard study, this is very interesting. They said, what are the reasons for longevity? First is genetics. In other words, it's the luck of the draw. You cannot choose who your parents are, but that only accounts for 40%, okay? The next would be the lifestyle. Do you have a healthy diet? Do you exercise? Do you have a healthy body weight? Do you have moderate alcohol intake? And you don't smoke? And make sure you're not in a place where people are smoking, because passive smoking can also cause lung cancer. Be very aware of that. But most importantly, you need family, friends, and community. Dr. Ed Tolentino touched on that. These are some of the things that help you, prevent you from being lonely, from feeling isolated, from getting depressed. Having family, friends, community. I like the way they call it in Spain, when they say, we don't do charity, we do solidarity. We are one with you. I'm not giving it to you because I'm wealthy. I'm giving it to you because I feel for you, and we are one community. That's a wonderful mindset, which I hope the Philippines will adopt. Next, please. Now, the more recent studies show that sleep is very important. The average person needs 7 to 9 hours of sleep a day. Unfortunately, majority of Filipinos, or majority of people, don't sleep that long. And what happens is you have what you call sleep debt. In short, may utang ka. May utang ka kasi natulog ka lang ng 5 hours, kailangan mo bawiin yung 4. You have to pick up the 4 hours that you did not have, and that can affect your chemical imbalance of your brain if you're not sleeping properly. And stress. I'm revealing my age, but during my generation, stress was not a popular word. You did what your parents told you. And if you disagreed, tough. You just followed it. Nowadays, I notice everybody gets stressed, kids, because, I had very young nurses, and I also ran call centers with PLDT. It's always, oh, I'm so stressed, I'm so stressed. I think if you say it often enough, it becomes a reality. I think you should develop a mindset of positivity and say, I can do this. It's not going to stress me. I'm not going to allow it. Okay, next. And of course, you need some financial stability. You can have all of the above, but if you're worried where the next meal is coming from, then you really have a major problem, right? You can be healthy for all intents. You can have a healthy diet, but if you don't know if you're going to have a job tomorrow, which is happening now with COVID, then that is the real cause of stress. Okay, next. Just some parting thoughts. Save for the unexpected, okay? And healthcare is not free. Remember that, not in our country anyway, because we do not, while we have universal healthcare, our government can only afford to subsidize up to 10% of our health bills, okay? Next, adopt a prevention instead of treatment attitude. Live healthy, follow the Harvard recommendations. Health is true wealth, don't economize on it. I'm very surprised at people asking me for discounts, complaining about the costs of their health health bills, and then I see them they're using Louis Vuitton original bags, and I'm wondering, why are you buying all of these expensive brand names, and yet when it comes to your healthcare, nagtitipid ka. You want to make tawad, you want to get the lowest cost. There's a disconnect there that seriously has to be addressed. Next. Research the credentials of your doctors so that you understand why he's charging you what he's charging you. Major hospitals have websites that will show you what the credentials of your doctors are, and therefore you can make an informed decision. But resist over shopping. I had a friend who went to 6 doctors and she ended up more confused. She didn't know what to do. Some said operate, some said don't operate. So in the end, she was asking me, what am I going to do? That's what happens when you overshop. That's why credentials are important. You will trust the one with the best credentials and the most cases handled, because in healthcare, experience matters, really and truly. Research on your medical issues so that you're in control of your destiny. Gone are the days where it's the doctor who will tell you what you should do. You have to understand. If you're a cancer patient and you don't want any more treatment because there's no quality of life, that choice should be yours. You should make an informed choice, but you are in control of your destiny. Next, please. Resist the temptation of also becoming an internet expert, or what I like to say, stop worshiping at the altar of the internet. Go to legitimate sources. And my son-in-law has a very nice rule of thumb. If you don't pay for your news, then you get crap. Okay? If you just get your news for free, then you don't get valid, legitimate journalism. So the same, don't worship at the altar of the internet. You go and research with Mayo websites, the websites of major hospitals, in order to make an informed decision. Next. I want you to practice Aristotle's concept of the golden mean, defined as, it is the happy medium between, next, show all of it already. It is the happy medium between excess and between deficiency. So go and stay the middle ground. Excess of courage is recklessness. You don't mind if you get killed or you get shot. You don't take precautions. The deficiency of courage is you're a coward. You let everybody else fight the battles, but you stay home because you're afraid. So always remember, in anything you do, especially in your work, always remember Aristotle's rule, the golden mean, because it makes for, I practice it all my life, all my career, and it has helped me retain my sanity going through 5 industries. Yeah. Next. So last, cheers to a long, healthy, and I wanted to add, because Vicki Belo is one of our guests, and Vicki's a friend of mine, long, healthy, and beautiful life with a lot of help from Vicki Belo, and most importantly, a joyful life. Aspire for joy, which is more spiritual in nature, rather than happiness, which is an emotion that is a transaction at the moment. Oh, I got a brand new Mercedes-Benz, I'm happy. But joy is a more long-lasting concept that gives you serenity and equanimity. Thank you. Thank you for your time.
Thank you very much, Ms. Rose, for showing us that prevention is really better than cure. Again, folks, if you have any questions for Ms. Rose, all you have to do is type your questions in our Q&A box at the bottom of your screen, and we'll see Ms. Rose once again in our Q&A session. Now that we've heard from our 2 speakers talk about caring for our physical and mental well-being, our next segment will discuss how an insurance plan can help us be financially prepared and secured in case health problems do happen. Now, I'm very excited to hear this, because when we talk about living healthy, most of the time we only think about working out, may meditation, may eating right, but being prepared with a health insurance plan should also be part of a health journey. To tell us more about this, we have one of the top insurance advisors of Manulife Philippines, Mr. Kevin T. Hi, Kevin.
Hello, Luis.
Yes, go ahead, bro. Take it away.
All right. Thank you, Luis. I'm really honored to be part of today's webinar and share the stage with our special guests, even for just 5 minutes. I've learned a lot from our speakers. Aside from the physical effects caused by critical illness, financial incapacity to treat it is also a huge stressor, which takes us back to our mental well-being, as touched on earlier. And based on a Manulife study, 80% of Filipinos believe that the cost of treating critical illness is higher than what they can afford. So it's good to have a ready fund as early as now for our healthcare needs because our savings may not always be enough. And we can never tell what illness will strike. At Manulife, we offer different kinds of flexible and affordable health insurance plans, one of which is our HealthFlex plan. Now, HealthFlex is an affordable health insurance plan that lets you choose and pay only for the health coverage you need for only 42 pesos a day. This plan can give you protection from over 100 plus critical illnesses, including the ones Ms. Rose mentioned earlier: cancer, heart attack, and stroke. This is guaranteed protection up to age 100. It's inclusive too. Even the elderly or people aged 70 can get this plan and live in comfort knowing that they are covered from critical illnesses. This plan can also be gender-specific illnesses. Another nice thing about this plan is that you can receive a monthly cash allowance benefit for 24 months to help you with your finances while you're being treated for a diagnosed advanced critical illness. You can use this medicine and therapy or even additional spending money while you recover and are not able to work. And lastly, a first of its kind in the market, where after your first claim, your coverage will reset to 100% after a year, giving you another full health coverage. This is through an early stage critical illness benefit. Right now, there are 4 bundles you can choose from, but I'd like to focus on our 3CI Plus bundle for now. HealthFlex 3CI Plus covers the top 3 critical illnesses that Filipinos fear for themselves and for their loved ones, which are cancer, heart attack, and stroke. You can build a stronger protection coverage on top of these when you add life-saving benefits like waiver of premium, early stage critical illness, recovery benefit, second advanced critical illness claim benefit, child critical illness benefit, male cancer or female cancer benefit. So this plan is really customizable and flexible depending on your needs. There are more benefits attached to the HealthFlex plan, and it is very affordable. And if you're interested to know more about HealthFlex and other health insurance plans, please contact a Manulife insurance advisor, and we will make it easy for you to find the one that fits your family's needs.
Thank you very much, Kevin, for informing us about HealthFlex. In fact, I was getting a few messages on social media now, Lab. Now they were confirming that you were the first runner-up sa Mr. Chinatown, correct?
Yes, correct.
Now you're speaking great words for Manulife, diba? And it's really interesting as you can really custom fit this plan depending on your needs. Now, our audience, they're really interested in everything that you've been saying, and we have received a few questions regarding this plan, but we have time for one question.
Sure, Luis. I'd be happy to help our audience.
Here we go. The question is, my dad is relatively healthy and added protection is great. However, he is already a senior citizen. Can he still apply for this plan?
Yeah, of course. HealthFlex is available for customers from age 0 to 70 years old, and they are covered up to age 100. So your dad can apply for the HealthFlex 3CI Plus plan, which includes elderly and 57 critical illnesses coverages aside from cancer, heart attack, and stroke.
Wow, nakikita natin na HealthFlex really covers anyone and everyone in the family, diba? Now, we would like to spend more time with Kevin and ask more questions, but for now, we do have to say thank you to you, Kevin.
All right, thank you also, Luis, and to everyone who listened. Don't forget to invest in your health. Take care and stay safe, everyone.
Thank you very much. And of course, taking care of ourselves and being responsible about our health also means getting a health plan that will protect us from sickness and medical emergency. So ayun naman, maraming salamat once again to Kevin. To know more about HealthFlex and Manulife's other health products, you can talk to the insurance advisor who invited you or scan the QR code flashed on your screen and submit your details so we can assign a Manulife insurance advisor to reach out to you. And for those that already have an insurance plan with Manulife, you can easily manage your policy, view payment information, pay online, get e-receipts, and more through Manulife Online. You may access your Manulife Online account by scanning the QR code shown on our screens. There you go. Now it is time to introduce our last but definitely not the least from our set of speakers. She is the president and medical director of Belo Medical Group, a celebrated dermatologist and doctor to the stars known for pioneering the skincare, laser, and liposuction industry in the Philippines. Please give it up for the beautiful Dr. Vicki Belo.
To all of you Manulifers, thank you so much for inviting me in Manulife. I'm learning a lot. I'm taking notes from Etol, who was my batchmate classmate, and Rose, who has been a friend for such a long time. Thank you for the plugging. And hi, Luis. I miss
Hi.
you.
Oh,
Isabella, baby,
nice
I
to
miss
meet
you.
you, Doc Vicky.
Yes, how are you? Anyway, I'm going to talk about, I think, more joyful things. I agree with Rose. It's about joy. It's not about being happy because happiness is temporary, but joy radiates from you no matter what the circumstances are. And what's a good way to keep your joy? Of course, it's important to care for yourself or self care. You know, even when you fly in an airplane, they always tell you make sure you put your oxygen mask first before you help someone. I know Manulifers are all about helping people, other people, making sure they're going to have money for their illnesses or whatever. But if you're running on empty, if you've given so much of yourself and you have nothing left, then you can't help them anymore. So this is going to be about you and how you can take care of yourself. Next slide, please. Okay, so what happened during the pandemic? Did it make us more beautiful? I don't think so, in spite of the fact that we're just staying home. Next slide, please. There is something called the quarantine 15. Can anybody guess what this is? It means, remember, freshman 15, when you're young, go to first year college, you're kind of stressed, you gain. Well, a lot of people have gained weight over the pandemic. They can't go to the gym, they just stay in the house, they're scared to walk out in the streets. So, can I show you a cute cartoon? Next slide, please. Yeah, and that's what I do to Scarlett all the time. I pinch her and then I go like this. But 15 pounds is average weight gain during the pandemic for some people. And of course, some people are getting stressed because they can see they can see the light at the end of the tunnel because of vaccinations and everything. And then what? We're going back to see everyone. We need to get rid of that 15 pounds. Next slide. How are you going to do it? Of course, eat a balanced diet. You know, this has been something that everybody's been discussing for a really, really long time, but I don't know many people that do it, right? Especially avoid eating junk food and sweets because that's what you usually eat when you're stressed. Next slide, please. So we have to eat a lot more fruits and vegetables, right? I actually am into intermittent fasting. I think it's wonderful. All the new studies, a lot of studies have shown that IF, especially if you follow David Sinclair, he's a scientist from Harvard University. He talks about how IF really helps you live longer. It affects your epigenome. That's all medical. But the point is, it's good not to eat for 16 hours. So normally breakfast is something we can skip, right? So we finish eating at 7 in the evening, at least I do, and then I don't eat again until about 12 or 11:30. And that's been able to keep my weight down. In fact, I've lost 10 pounds over the COVID quarantine. Next slide. Exercise. Exercise is not just good for your body, it's also good for your mind, for your mood, because it's also important to look young. Not just look young, but of course to move young. And I was very proud. I just came from Bohol and I was able to keep up with everyone and the way they moved. I didn't, nobody had to help me. So I think it's important that you look really good. Next slide, please. But when all else fails, of course, where do you go? Ano pa? Please, I'm just waiting for you here. Next slide. There's Belo. So let's talk about Belo and how we pivoted during the quarantine period so that we help people take care of themselves. Well, of course, in the clinic, we have this 360-degree liposuction. There's been an uptick in the world, especially in the US, for liposuction to get rid of the 15-pound weight fast. I always think of quarantine as a metamorphosis, like you enter a cocoon and then we will emerge more beautiful, right? Younger looking and happier at the end of this quarantine. So this is 360-degree liposuction. Why do we call it 360 degrees? Because at Bella, we suction at all angles. You know, a lot of people, when you're under general anesthesia, they can only suction the front. But since we do it under tumescent anesthesia, where you're just a little high, you don't remember anything, but you can stand and turn, then we can do the whole 360-degree lipo. Next slide. So here's her before and after. Here's Bianca Valerio, who was a model, gained a lot of weight because of stress, and here she is after. Next slide. So I don't know what's happening with this generation, but I see a lot of big arms with women who are 30 and below. I've been in practice for 31 years. I've done 15,000 liposuctions in my life, and I've noticed in the past 10 years, for some reason, people are getting big arms, the young kids. And I think it's because of the food, maybe because of hormones in the food, so that's why for some reason they're getting big arms. So this is Morissette, who was very conscious because every time she sang, the microphone, the camera would go to her arms, and this is her after liposuction of the arms. She did this when she was 21, I think. Next slide. This is Jinky, of course. She is my very loyal patient who's been with me for 15 years. And this is her before. And she did her makeover because she wanted to look good for the cameras. Whenever Manny Pacquiao would fight, they would focus on the wives. And she felt that since most of them were Hispanic, Mexican, they would be very beautiful. And she wanted to make our country proud. And I think we achieved that together. Next slide. Okay, another phenomenon that I see with this quarantine is a lot of kids have very dark circles. We call them panda eyes. One is they're always in front of their gadgets. Secondly, if you rub your eyes a lot, you cause friction and hyperpigmentation for melanin to be attracted to your around the eye area. Thirdly, when you sleep late, it really increases your cortisol level, and that's one of the signs, dark circles. So we can do something about it because it makes you look very tired even when you're not tired. Next slide, please. So we have a whole thing called the Bellify, and our models for this were Catriona Gray and Piola Pascual. Next slide, please. So this is Piolo, and he's doing the Bio NutriGlow for the under eye area. This is very popular in Korea, by the way. If you've been hearing about the Chanel injection, this is what it is. It's NCTF 59 vitamins, minerals, peptides, hyaluronic acid. You inject it around the area of the eye. It doesn't hurt because, of course, we put cream anesthesia. And what it does is it nourishes the eye, gets rid of the dark circles, and makes sure eye skin tighter. So if you're beginning to have sagging lids because of rubbing and tearing the elastic fibers around your eyes, this is something good you can do. Next slide. We also have the Bellify kit. So you go to our shop.bellomed. I forgot, I'm not good at that. Shop.bellomed.com. We send you an eye cream, peptides, wonderful eye cream that tightens the skin, decreases darkness, increases elasticity, and gets rid of fine lines and wrinkles. We have the eye mask. Now the eyes are a special focus because if there's one area that needs a lot of hydration, it's around the eye area. So you need a richer mask around this area. Next slide. Acne breakouts. How many of you had maskne? So many people have broken out, including Julia. I think 3 months into the pandemic, she called me up. Dr. Bell, I'm freaking out, I'm breaking out. Well, this is because of wearing a mask. Just the actual physical rubbing of the mask against your skin causes irritation of your oil follicles, and it causes acne. Also, when you talk, the bacteria, instead of just going out into the atmosphere, bounces back into your face, touches, and then you're continually rubbing it in. It's very hard to treat because you're still wearing the mask and you're still getting the bacteria. So the best way to avoid this is, next slide please, is it maskne? Anti-maskne mask. It's using the anti-maskne mask. So I'm very proud of this mask. It took me a long time. I tried at least 100 masks before I found the right mask. It's made of an incredible material that doesn't make it, it's very soft, no corners, so it doesn't cause friction on your face. It has silver and copper, so that these are natural antibacterial elements, so any bacteria that touches the mask dies, so it doesn't just keep going back to your face. Next slide. Again, you can get it at Belo. What else has happened? Oh my gosh, this is so great. Masks are what people wear when they have a nose lift or a rhinoplasty. But now, since everybody's on a mask, we saw a big increase in our rhinoplasties, 300%. Plus, there's this new thread nose lift, and that's also very popular. Next slide. Because people can hide. So here's rhinoplasty before and after. You know, the typical Filipino nose is wide with a round tip and no bridge. So we have to address those three things. Next slide, please. Yes. You just look a lot. Of course, Belo prides itself in getting natural noses. Our doctors actually sculpt your nose beside your face to make sure that it matches your shape of your face. Because before they used to have just ready-made implants they would put, and you have a Spanish nose, Chinese eyes, and a round face. It doesn't look good. So now we make sure that it looks very natural, and we sculpt it. Our doctors are good sculptors. They make your nose Parang ano, bespoke for you. Next slide. Okay, skincare trends for 2021. Let's see what's new in skincare. It's now skinimalism or skip care. A few years ago, it was all about 12 steps, 15 steps. Meron pa ngang 20 steps, Korean skincare. Number one, I want to remind everybody our weather is not at all like Korea. It's quite warm in the Philippines and humid. So all those serums and oils on the face were causing quite a lot of breakout. But now, since we want our products to be multitasking. In other words, next slide, please. When we wash our face, we already want a scrub. Next slide, please. So here is the Zeo Skip Care. So you only have 1, 2, 3, 4, 5, 6 products, including sunscreen already, which you have to use all the time because our gadgets do emit some UV radiation, which can cause a lot of pigmentation. Even reading by a bright light, that's why I keep telling them to turn off my light when I'm not on air, because it can attract all the melanin to the skin, like a magnet. So this is a skip care. Next slide. So we start with whatever, like we took sunblock, exfoliating accelerator. There are 2 creams that everybody, if you ask me, Dr. Belo, if you could only use 2 products, what would it be? I would necessarily say it's vitamin C in the morning. That's a minimum. Why vitamin C in the morning? Because it is an antioxidant and it fights free radicals. And vitamin C for the face is just like vitamin C for your body. It kills those Pac-Man cells from eating up your protein. Of course, and then in the evening, you use vitamin A or retinoic acid because that's been something that can cure pimples. It's anti-aging, produces new collagen. And of course, those are the 2 products. But for your eyes, you do need a separate product. And then the sunscreen, which is, I don't think a skincare, but a protection, you need it also no matter, even if you don't go out. Next slide. Oh, what's it? Okay, what's that one? Is that the sunscreen? I hope I can't see. Okay, next slide now. Next slide, please. Okay, so this is something that I talked about last year. I've been advocating microbiome for the longest time. So there shouldn't be an S because microbiome is already an environment. What is microbiome? Microbiome is the environment in your gut. So you're only as healthy, they used to say you're only as healthy as what you eat. You are what you eat, but no, that's not really true. You are what your microbiome is. It's a whole environment, like a whole country in your gut. And the Filipinos are notorious for not having healthy microbiome. This is like 90% of the cells in your body, bacteria, both good and bad, and it's been shown to affect everything from mood, from losing weight, from, just being healthy, being able to move. If you're not balanced in your gut, it has deleterious effects on the rest of your body. Why are we not balanced in the Philippines? Because we take antibiotics like it's candy. We don't finish our 7 days. When we're sick, we take 3 days and, oh, I'm better now, it's gone, we stop. That causes resistance to antibiotics. We tend to take antibiotics even when we don't need it. So it kills all our bad bacteria, yes, but it also kills good bacteria. And so you're totally unbalancing your microbiome. And I found out that if you just get healthy microbiome, you will lose more weight, your skin will clear up. There's so many advantages. Where do you get it? Next slide, please. Microbiome is essential for human development, immunity, and nutrition. Next slide. Okay, this is something that I've learned to eat every day. I think the Koreans have good skin a lot because they eat kimchi all the time. We need fermented food that has good bacteria to replenish what we have lost. I used to love kimchi, but now I can't stand it anymore because I'm eating it every single day. But what I do is I put kimchi with like a wrap, like a taco wrap or a lumpia wrapper, and then I put a little chicken that's broiled, and it really has helped me keep healthy and made my skin much better. Next slide. Now, skincare, you are you. You are not like anybody else. You are special. So you should really go to your dermatologist to have personalized skincare. You know, a lot of people come to the clinic, I want what she did, I want what she's using. But you know, you go to an expert because they can analyze your skin and determine what it is that you need. So please listen to your doctor. As Rose said, stop going to the internet. It's become such a headache for us because they know so much information, but it's not deep, and sometimes a lot of times it's wrong. Next slide. Next slide, please. So again, ZO, why do I keep putting ZO here? Because Zainobaji products for me are the best in the world. Of course, we have Belo products, but I bow to Zainobaji, really has good products. Next slide. Blue light protection. So a lot of people have skipped sunscreen because they feel, anyway, I'm at home. Well, you can't, because the blue light in your gadgets, your computer, your phone, they do cause damage to your collagen and elastin. In fact, I'll show you a biopsy of that. Next slide. What is it doing to your skin? Next slide. I think I'll be on time. Next slide, please. So the New York Times talked about what is all that screen time doing to your skin. Next slide. It emits a blue light, which can totally cause hyperpigmentation, fine lines and wrinkles, destroy your elastin and collagen. Next, press again, and I'll show you a biopsy of what it looks like. So if you look here, those are holes in your dermis that are caused by blue light alone. No sun damage, just blue light damage. So you have to protect yourself. What's the best thing to do is to use sunscreen even if you're at home, and make sure that it's a broad spectrum sunscreen. Next slide. That protects you from UVA, B, and C. The Belo products do protect you. We have a new product that's very popular. It was the #1 selling product on Shopee. It's a powder sunscreen. So not only do you get protected, but you also have some light makeup. Next slide. Maskne treatments. Well, if all else fails and your maskne is really bad, you can get some of these products at home. Just go to our shop.belomed website. These are the ZO oil control pads. They have salicylic acid and a lot of things that will calm the skin down. So not only is it antibacterial, it's anti-inflammatory, and it normalizes the shedding of the skin. You just put it all over your face, one pad, after you wash your face. Next slide. Vivace. Vivace, finally, I'm so happy because there's a machine that can control acne and oiliness. I had very bad acne, and that's why I became a dermatologist, because nobody could cure it, and I was already 30 and it was so ugly. And here now with Vivace, we can actually dry up the oiliness using this machine. That's also anti-aging. So if you see on your left side, this before with all the acne, and look how small the pores are, how much smaller the face is, and how much clearer it is without the acne. Next slide. Now we have a lot of home skincare devices because of the last year where everybody wanted to stay healthy and have good skin at home. So here, in 15 minutes now. But hurry. Next slide, please. So we have some of our Belo It Yourself kits. We call it BIY, as opposed to DIY, which is do it yourself. So we have the body scrub. A lot of people still want to look bright and lighter skin. That's great for you. It's a soap and a scrub, and it's perfect. It really, and an illuminating system. It works really well. And then we have the face brightening kit. Of course, for some reason, the Philippines is the #1 when it comes to caring about armpits. We want our armpits beautiful, even tone, not dark, no chicken skin, no cracks, no sagging. So the way to do it is with the armpit perfecting kit. Next slide. And we have this one. This is my favorite. It's brand new. It's only been around a month, but it's a mask from Korea, Dr. Fran's mask. And this amazing mask, next slide, it's so good because it has microcurrent. Next slide. So you put it on your face. It's 2 sheets. And you have this amazing hydrating solution that's made of peptides, ceramides, hyaluronic acid. You put it on your face. There's a wet mask. Then you put the You put this thing, which is like the tube. It's like conducting gel, and then you put another mask which has current. You don't feel any current, don't worry, but it does drive the solution really deep into your skin because you need hydration from inside out, not just on the surface, but you want it to come from inside out. And you will see when you do it, your skin will feel so soft and hydrated, and the next day you will see a nice lift. You can actually feel that your face is a little hard to open your mouth because it's so tight. Next slide. Online dermatology, we're doing a lot of Zoom consults. It's so great. I get to stay home and still meet all of you. You do it through, you can buy it again on our shop.bellomed.com. Next slide, please. So who did I call? I think it was Julia that I first consulted. And yeah, so I did Jess Wilson. So many people over the pandemic who were just breaking out left and right. Next slide. So it's great. I love it because actually it's face-to-face more. And yeah, I don't know. It's just, I feel more personal for some reason on a Zoom consult. Next slide. Well, thank you everyone and have a Bello beautiful day. Remember to stay joyful and grateful. You know,
Okay, we might have a bit of a technical difficulty with Doc Vicki, but Doc Vicki will be back in a bit. Thank you very much, Doc
hi,
Vicki.
I got cut off.
No, we can hear you, Doc Vicki. Are you there?
Hi, I'm here.
Yes.
I'm not.
Okay, we want to say thank you and for reminding us
Hi.
all these things, no matter how busy life gets, we must never forget to take care of ourselves. Kaya naman our next guest who will join Dr. Vicki is one of her Bella babies na obvious naman. She never forgets to take care of herself. Let's all welcome the beautiful, talented actress and fitness advocate, Miss Julia Barreto.
Yay!
Hi, Julia.
Hello! Hi, everyone! Thank you, Manulife, for having me. Dr. Vicki, Tito Luis. Ay, Tito!
Ay, teka. Medyo nananakit ka na.
Joke lang.
Nananakit ka na, Julia, ha? Ramdam ko yun. But then thank you very much, of course, Julia, for joining us. And we're still with Dr. Vicki. Now, our audience wants to know what's your take on the trends regarding health, self-care, and wellness right now. So I believe our friends in Manulife, they sent you reaction boards. May we see them? Okay, we have to check. Yeah, may smiley, may sad face, and everything. Okay, so everyone's
so happy.
Yes.
Is that
Okay.
correct?
Yes, we can see them. Okay, and you get to explain naman. What's going to happen is, I'll be saying a specific trend, and you have to show your reactions using our boards. So then explain why your reaction is that way. So are you ready, Dr. Vicki and Julia?
Yes.
Okay, the first one. Ito yung usong-uso na drink ngayon, ang kombucha, which is basically a fermented tea full of probiotics and antioxidants. Oh, Julia.
I haven't tried it.
Okay.
I can't be the judge.
Okay, so Doc Vicki, I see a smiling face.
Yes. Well, I talked about microbiome, and kombucha is one of those fermented drinks that does give you microbiome. However, I would like to say also that it gives you gas. And it bloats you a bit. So I would still do kimchi, but it's pwede na if it doesn't affect you that way.
Okay, next up, this is something that if I had one, I'd put a big smile on it. Pimple popping videos. Addicted to it. If I was going to be a dermatologist, it would be because of that.
It's so satisfying.
Yeah, it's either you love it or you hate it, di ba?
Yeah.
Like, ikaw, Doc Vicki, do you ever get sick of doing the procedure? Or do you also feel the relief that a patient does?
No, I love doing it. I love it. The more creamy, the bigger, the more exciting. That's what you call instant gratification.
Ako. I guess we're all addicted to it. And some are in denial that they enjoy it. Okay, next up. LED facial mask.
Shucks.
Right.
Okay. Julia? Smiley.
I bought na a lot from online stores, but you know what? Honestly, nothing works better than an LED mask from your clinic, from your dermatologist's clinic. So, don't do it at home pa rin.
Doc Vicki, your thoughts on the LED facial mask?
You know, I bought It depends, right? The LED mask that I guess we're talking about is the red light and the blue. That's really good. But I don't know about the home devices. I'm not sure. And then there's this new LED mask that looks like current, that when you close the light, makes everything fluorescent. Yeah, but it doesn't. That one, I tried it. It didn't do much. So I'm neutral. It depends. I think, as Rose said, you get what you pay for. So if it's cheap, it probably doesn't work. And if it's a more expensive kind, it will work.
Dr. Vicky, tatanong ko lang, with my face and how special it is, that electric mask you were talking about earlier, siguro sa akin, dapat hindi lang siya basta yung double cream, di ba? Dapat isaksak pa sa 220.
Alam mo ba ang gwapo mo, Luis? Ngayon, feeling mo? It's really good. You have to try. I'll send you.
I will.
Pa Father's Day, but that's our giveaway to the ambassadors.
Well, hopefully soon.
Okay,
next that you have to react to, plant-based meat.
Oh.
Okay, see, Doc, I can't see.
Can't you see? Oh, there.
There you go. Okay. So, si Julia, it's a smiling face and sad face. So I guess you're both iffy about it.
Well, I tried it, Beyond Meat, but hindi ako na-satisfy. And then it had konting dugo pa, and those vegetables, but a little mind-blowing.
Okay, ako personally, I liked it. Julia?
Me naman, if there is a substitute, I would try it. But I can't say totally yes because I like meat also, so I don't want to be a hypocrite. But I've tried a lot of plant-based meat that are really, really good.
Okay.
Yeah.
The next one, I saw this on social media. Beer yoga. Okay. Now, for those who don't know, beer yoga is a type of yoga that integrates beer bottles or even consumption of beer while doing certain yoga poses.
Oh, I haven't tried that.
Ano ba?
Yes.
Kita ba?
Okay. Julia, hindi pa nasusubukan. Doc Belo, beer yoga. Bakit sad face?
I think it doesn't make sense. I mean, one of the reasons you do yoga is to stretch, and then I think the breathing is good for your stomach. Parang to put beer, then you'll get a beer belly. It's parang counterproductive. I mean, and it's a fake relaxation. You want to learn to relax just by meditating while you're doing yoga.
Okay,
diba?
Next. Glass skin facial.
Oh, of course. Girl.
Of course.
Ayan. What's the double pa kay Julia? Julia, what's the best part about the glass skin facial?
Well, the best part about it is still being confident going out even without makeup, and your skin looking luminous, glowing, and very youthful. And being like you, youthful, glowing, and luminous, you are very, yes, you.
Me?
You.
Me?
You.
That's yours.
And as a K-drama fan, they all have glass skin, so I like that it's achievable now, especially in the Belo clinic.
Okay, next up, pore vacuum.
I tried.
Okay.
Where is it? How come I keep disappearing? Where?
Yeah, let's ask Doc Bell about it. Why the sad face, Doc?
Because it can be so traumatic on the face. I've tried it just to see what it's like. It has so much pressure when you suction, then you break blood vessels, especially around the nose. So, and I think in a way it might stimulate the oil glands to produce more oil.
Okay.
I don't think it's a good idea.
Okay, last but not the least that you have to react upon, intermittent fasting.
Oh, yay! Okay, put it to the right place.
Okay, so ang karaniwan nakikita natin is 8 hours. They follow the 16-8 protocol. What about you guys? Do you follow 16-8 or do you go a bit past it?
Me, I follow the 16-8, but if I can go longer, I will go longer. Doctora?
Yeah, I do 17, I think. 17-7. Tama ba yun? 17-7? Yeah, 24. Because I don't eat breakfast, so I eat my last meal is 7, and then my next meal is 7 p.m. and my next meal is 12 noon usually. But if I can't take it na 11:30.
Ako, Doc Bello, I'll ask your advice regarding intermittent fasting. Kasi ang plano ko gagawin is I'll have my last meal mamaya ng 8 p.m. Tapos kakain na ako ng mga November 4. Okay ba yun?
Wow! Nasana tayo nun sa
Papayat
cemetery.
pa ako nun. Will I lose weight?
Of course, you know, for later, IF is the best because fasting pala. Makinig, I'm serious. Fasting, it's so good for your body because it stresses your body just right to wake up your anti-aging epigenomes. So, it stresses so you repair your body while you're... And what I found out, everyone, Manulifers, you try it. I've never felt so energetic as when I do an IF. Yung totoong IF, because for so long pala, I was making mali. I was drinking vegetable juice. Kala ko, that's still no calorie, but it had because it had half an apple, which is about 40 calories, but that destroyed the whole fast. So it should really be coffee with no sugar or water lang. Then you'll feel like, you know, like when you're running, I hear you get a second wind. When you're IFing, you feel so strong. I'm parang the less I eat, actually, the more energetic I feel.
Well, hindi kaya kung gawin ko yon, Doc Vicky, yung mamaya ako kumain, tapos November, imbes na strong, agaw buhay na ako nun. Hindi kaya?
Yeah, November, tagal. Kita na tayo sa All Saints Day, November 1.
Yeah. But thank you very much, Julia and Dr. Vicky, for a fun and informative bit. But we will see Dr. Vicky later on pa sa ating Health Talk segment. So we'll take a quick break with Doc Vicky and we'll talk to Julia. We'll see you in a bit, Doc Vicky. So Julia, how are you taking care of yourself and your whole well-being during quarantine?
You know what? I really just tried my best to find ways to keep myself sane, finding activities that could be the perfect outlet for whatever anxiousness, anxiety, or worries that I had.
Ito, tanong ko sa'yo dahil, you know, I follow you on social media, you are a friend, at nakikita ko yung progression na, wow, may abs na si Julia. Iba? Kondisyon na kondisyon. So what do you do? What's your workout? Are you a yoga person? Are you a HIIT person? What do you follow?
Okay, so I'm the biggest Pilates fan.
Okay. All core talaga.
Yes, I like Pilates because I think it hits the muscles that we don't think we should be hitting, and then it's sort of like a meditation for me, like it's a quiet time, it's the time to breathe and get your stretches in. But I realized that you can't just be fit and not be strong. So when I realized that I wanted to feel more strong and just more strength, that's when I kind of mixed it up with like weightlifting and a lot of circuit and a lot of cardio. Although I'm not the biggest fan of cardio, we have to for stamina.
Kailangan naman talaga. I mean, I'm not a fan of running. Pero just last time, tumakbo ako ng QC Pagudpod. Kaya naman, pero... Okay. Okay. But kaya naman. It was a challenge, pero kinakaya naman. I mean, that's how we do it. Pero ito, let me ask you, we were talking about IF earlier. Do you mix any other diet with IF? Like, for example, have a friend who does IF and keto. Ikaw ba, do you eat anything as long as it falls inside the window?
You know what? When I was a few years back, I thought the best diet is just eating less than what you should be intaking. But I think the older you get, the most sustainable and easy to maintain diet is just the balanced diet. So I also realized when I diet so much, so strictly, it affects so much my attitude and my patience and everything. So what I've been doing now that's been working for me is just balanced diet, just more workout because I like to eat. So bumabawi na lang ako sa workout and just being active. Right now I can eat whatever I want, pero syempre yung tama lang, don't overeat.
And siguro aside from working out and eating healthy now, one thing that has been resonating with so many people throughout this whole webinar is how we take care of our mental health. Hindi ba? Now, one thing, I guess, unfortunately, it's part and parcel of what we do in the industry is the negativity on social media. So how do you handle all that?
Well, you know, it's something that I grew up with. Just I lived with criticism my entire life. I wouldn't say that now I'm immune to it. I don't think it's something you'll ever be immune to, but I think now I've become wiser in how to handle it. So like what I always say, it's so important for you to compartmentalize things that matter to you and the things that don't. So, when it's the criticism from people I don't know and who don't know me and don't play a significant role in my life, it's easier to shrug off and not worry about. The criticism that only matters to me is, of course, the people that are really within my circle and my family, and the people who can be honest with me and constructive criticism. Hindi yung criticism na
Just to bring it down.
Yes, exactly. So compartmentalizing.
At sabi ko nga na ngayon you're a fitness advocate, so anong gusto mong sabihin sa lahat ng mga nanonood ngayon who just want to take that first step? Or minsan kasi that's the most difficult part, is taking that first step into your fitness journey. What do you want to tell them?
Well, I'm also not perfect. So, for example, now I was in lock-in for 1 month and I was filming every day, the whole day. So it didn't give me much time to really work out. So tonight actually is going to be my first time to work out after a month. And day one is usually what I dread the most, because you don't feel as strong and your motivation is not the same. But you know what? The first step is the most important, because after you take the first step, tuloy-tuloy na yan. It's domino effect and it's the beginning of everything. So take that first step and you'll be surprised. It's going to change everything for you. Don't be afraid.
Thank you very much, Julia. Alam ko maraming nabitin sa game natin kanina. Yung audience daw ay sobrang nabitin din. Kaya naman we'll have more good vibes para sa lahat. Maybe call on Dr. Vicki again to please join us. Hi, Doc Vicki. Welcome back. So we'll have another game. Now, this game is called Never Have I Ever. Ito ba, Doc? Nalaro niyo na? I'm sure si Julia has seen it in different vlogs na rin. Ikaw ba, Doc? Nalaro mo na ba to? Never Have I Ever.
Never have I ever. Okay.
Yes. So
Parang double negative so doon ako nako-confuse. So if I've never done it, what's the X?
You've never done it. If you have, I'm going to mention a few instances. If you've done it, please raise the check. If you haven't, then you raise the X or the cross.
Okay.
Okay? So here's the first one. Never have I ever binged an entire Netflix series in one day.
Oh.
Si Julia did already? Okay, so Julia, first things first, what series?
Emily in Paris.
Okay, talagang sinagad mo isang upuan.
Oh, yes.
Ikaw, Doc Vicki, ikaw ba? You don't have the time ba? Or...
Yeah, I feel guilty because Scarlett sleeps with us, so no time to do... No, I did Emily in Paris in 3 days. But not because the question's overnight, diba?
So it was a mini.
So when you have babies, Jules, you can't do it anymore.
Yes.
Okay, next up. Never have I ever gone vegan.
Oh, I tried.
Ay, mali.
Okay, so how was it for you, Julia?
Oh, I lasted only 2 to 3 weeks, I think. Meat is very important to me. And because I did like a blood test wherein you find out what foods are good for you.
Yeah.
I'm tolerant to all types of meat, so I wanted to keep that in my diet.
Okay, next up is never have I ever not eaten. Ito medyo extreme to, and a lot of people are guilty for this. Never have I ever not eaten for 1 whole day to lose weight.
Yeah. Not good though, not good.
Now, this was siguro the time na when people were still misinformed. Now, that's the only way how to lose weight. Di ba, Doc Belo?
Yes, that's actually, you slow down your metabolism when you do that. So it's not a good idea.
Yeah.
It's really, IF is really the way to go.
Ito, pinaka-controversial to para sa akin. Ito, never have I ever gone more than 2 days without showering.
Oh, no.
Di kaya.
Di kaya.
Okay, well, tama.
You?
Me, I shower 5 times a day or 3 whenever I perspire, shower.
Pero diba, Doc Belo, they're saying that sometimes it a bit maybe too much kasi you lose certain oils and everything skin.
Well, the advice is don't shower more than 2 times a day, right? And then don't take very hot showers, which I love to do. Kailangan warm lang, di ba? Because it will dry up your skin. But I don't listen to my own advice. But I'm telling you that's what you should do. But me, love the feeling of hot. Diba? So
okay. Eto, maganda to. Maganda rin na naman to. Never have I ever stalked an ex in social media.
Aamin ba tayo, Jules?
Read Doc Belo's
Sige, I
answer.
have.
I'll have to say
Eight
this
na.
na lang. Kasi
Ay,
syempre,
bad girl.
Okay, so ito, si Julia sabi niya, never. Pero ito, Doc Bello, my question for you dahil apparently your reaction is you have, di ba? Before.
Yeah.
What if lang you accidentally liked his picture?
oh my gosh, that's the worst.
Oh my God, talaga. No, I remember.
The picture ng like mo was from a year back. Talagang ang
But of course, I
baba.
wanted to see who is dating na, ganyan. But if I did, I would scream, I guess. But I think what I did is I used to use my friend's phone. Para walang mistake talaga.
Wais talaga. What?
Oo, di ba?
Yes,
Kamali nga.
Ako ito, para wala nang wala nang gulo.
mahirap na.
True.
Okay, wait lang. Okay, we have some questions in a bit, but for everyone, it is not too late to hit the Q&A box and ask your questions for our speakers. Right now, we're getting a lot of questions mula sa audience natin. I'm also excited to hear our guests answer all these. But before that, make sure to stay tuned until the end of the webinar because Manulife Philippines is giving away telemedicine vouchers from Medgate Philippines to 10 lucky winners. Now, these vouchers can be used to consult with doctors in the safety of your own home. So please watch out for that. Now, before we proceed with the Q&A or our health talk, we'd like to first acknowledge the presence of our friends from the media. We have our friends from Preview, People Asia, Click the City, When in Manila, Female Network, ABS-CBN, Manila Times, Where is Ed Uy, Boy Racket, Manila Society, and of course, Lifestyle Portal. And now we're ready to bring back all our guests on screen for our Q&A segment. Hi guys, welcome back to Miss Rose, Dr. Ed, Dr. Vicki, and Julia. And yeah, we have Dr. Ed with us. Okay. Is Doc Vicki and Ma'am Rose with us?
Yeah, I'm not there. No.
Well, she'll be there.
We
Okay,
are.
Doc Vicki, we'll start with you. So what are the common illnesses that we need to watch out for as we continue to work from home? People hear about vitamin D deficiency, obesity, anxiety. So what can we do to prevent all that?
Well, vitamin D, definitely because you don't get enough sun. So you should really go out and at least 10 minutes a day between the hours of before 9 a.m. because the sun is really bad there. Anxiety, I'm such a believer in meditation. So I was so sad when I saw Rose's thing that said only 5% of people meditate. And I think that's really a good way to quiet yourself down. Just really be still and quiet. And then it gives you strength to face the day. So...
Okay.
Yeah, I would really recommend it. There's a meditation thing, and it's called the Brian Weiss, WEISS, for Manulifers who want to do good meditation. It's for health, and it's really been helping me, I think, stay healthy.
Well, for Julia, who's also now a Fitspo, people are asking, who is your Fitspo?
You know what? With or without Dr. Belo in this call, I would have to say it's her.
Oh, I love you, Julia.
So, really, it's pretty amazing. I remember entering her house and she was just in this robe and I couldn't help but take a photo and be like, oh my gosh, I want to be exactly like her when I grow up.
Thank you for not saying grow old.
No.
Okay, next question is for Dr. Ed. Dr. Ed, as parents, how to deal with children distressed because of online school. I know it's such a new format that kids are having a hard time. Even our teachers are having a hard time because they're at home. Sabi mo nga, the boundaries, there are no more boundaries. The place that you consider as rest, it's back to work or school, and of course the lack of social interaction. So how will parents deal with that?
First and foremost, it's very important to have a differentiation between very young children who may display distress in a different way. So those who are much younger, they would be more clingy, more anxious, more withdrawn possibly. Children usually manifest that they are in distress when they are more irritable or agitated, or those who have gone advanced in terms of the things they are able to control, like bedwetting, they may go back into younger behaviors. So it may be very important to reassure them. Parents need to be the model for kids. As Vicki was mentioning, we look into like when there's a crisis inside a plane, we try to look into the eyes of the stewardesses to reassure us. And it's very important as parents that we reassure our kids. Now, the older kids, luckily, are actually digital natives. So they have their gadgets with them all day. Actually, even when sleeping, it's right beside them, no? So very important. What parents can do is to make sure that you involve them in decision making, how they would want to restructure their day. Very important, as I mentioned earlier. How are you feeling about this? What are the main things that causes problems, especially with online schooling and all that. We could also help them. This was already highlighted by Vicki, etc., when she highlighted how we can solve problems, also by Rose. You teach them how to see, for example, a negative thing such as what's going on right now in a more positive way. In fact, these present as opportunities right now. Okay, opportunities to look into what are the things that I could learn over the course of this work from home or online schooling situation. But if everything else fails, for example, they have had previous or pre-existing mental health problems, it may be important to also involve their respective physicians in being able to carve out what might be the next best thing to do.
Okay. Thank you very much, Dr. Ed. Now, Ms. Rose, now during your time sa Makati Medical, what was the percentage of people using, health insurance, or against those that rely mostly with the common means of financial assistance, like, health cards or government benefits?
Okay, 40%, only 40% for HMOs. Then, of course, you have the 10% of PhilHealth, that makes it 50. HMOs and corporates would be 40 because they're one and the same, right? It's substitutional. And the rest, really, 50% are personal payments. That's why I'm a strong advocate of saving, a strong advocate of buying additional insurance as you get ahead in your career. As you get older, you get promoted. Instead of thinking of buying a new phone, why don't you add to your insurance healthcare benefit? Because you never know when it's gonna come, when it's gonna hit you, and you don't want to be in a panic when you have no choices left for you anymore.
Yeah, Julia, let me ask you, we were talking about it earlier about the unfortunate, part and parcel of what we do in the industry. Now, once, for example, that you're getting, a lot of negativity online, does your family play a factor, or do they let you be?
Oh, that's the biggest factor for me. I think that's the most important support you could get. And at the end of the day, I feel like when you have your family as your core support, I think you'll be fine.
Okay, tama naman, tama. Family will always be there to lift you up. Now, Ms. Rose, we have a question. We have someone wants to ask about chemotherapy. If it's still the best treatment for cancer.
No, there are 3 types, depending on your cancer. For example, breast cancer. If it's operable, they'll do surgery. Sometimes they'll put chemotherapy first, right, Vicki? Because they want to shrink the tumors. And then after that, they'll do radiation therapy. So it's not either or. It's all of the above. Because that's just the nature of the enemy, right? It's so treacherous, and I speak from personal experience. My daughter, who never smoked, led such a healthy lifestyle, has good genes because we have no cancer in our family, passed away from lung cancer at the age of 39, just a few months ago, 7 months ago. And it was inexplicable because everything that we say we should be doing, she was doing. She exercised, she wasn't overweight, slept well, but you never know. Because I think cancer nowadays is also environmental, right? It's not environmental and all the things that we put in our food, all the additives. So it's a combination of, if anyone knew what causes cancer, then he'd be a billionaire, right? Unfortunately, it's still an unknown.
Yes. Doc Vicki, you wanted to ask a question.
I'll try the question because Rose just said that she brought her daughter to Sloan Kettering. And I was wondering, because I hear a lot about immunotherapy, and that from my understanding, Rose, it's like if you have a bacterial infection and you do culture and sensitivity, you put the microbe there and you put the antibiotics around, that will work best. Is it true that they can do this for cancer as well? That there are 89 different kinds of breast cancer, for example. So there are different medicines that could actually attack that, but they just give you one chemo that will kill, carpet bombing everybody, and it's just a question of whether the person dies or the cancer dies, depends on your strength. But that they could actually nowadays be more specific, but because of big pharma, it's a $20 billion industry, they don't want to go there first. I mean, I just hear this, so I think maybe you have more experience because you went to school.
No, chemotherapy now is very targeted. Okay, it's not a shotgun approach anymore. They actually do DNA testing to figure out whether your DNA is compatible with the chemotherapy they're recommending to you. But immunotherapy is still in the developmental stages. I was trying to get my daughter into an immunotherapy clinical trial, but it was only stage 1. So they said between the stage 1 and the targeted chemo, Dr. Drilon of Sloan Kettering was recommending doing the targeted first, and then when chemotherapy is on the second or third stage. Unfortunately, after I had done that, coincidentally, somebody from Israel got in touch with me via internet asking me if I wanted to do some consulting because they want to penetrate the Philippine market, and they are very high on immunotherapy, but I was just a few months late. But no, Vicki, they have targeted. They will check your DNA. You have to go. Sloan Kettering gives you a test. Bloody expensive. It costs $3,000, but they will map out your entire DNA.
Is that the same in the Philippines already, Rose? Is it
that one is in the Philippines, for example, if you have lung cancer, the first thing they'll do is test if you're EFKG positive or EFR positive or negative. They're beginning to do it, but they don't have the same variety of options as you would, let's say, in the US or in Europe. But we're not far behind, Many of the doctors were already talking the same thing.
Thank you very much, Ms. Rose. Sir Ed, my question for you is, ito maganda tong tanong na to. How do you stay mentally healthy while caring for someone who has mental issues at the same time? It's sometimes difficult having to be strong when all you want to do is give up.
Very, very important question, because I know that a lot of us are caring not just for even mentally ill or physically ill individuals at this point. Very important is we're going back to what I mentioned earlier, and that is self-care. It is okay actually to make sure that you are a-okay. You are not doing any disservice by taking care of yourself. It's important to take breaks, for example. If there are several of you in the family, it's important to delegate, for example, and have your care for yourself time as well. You will only be good for your loved one if you are whole as an individual, biologically, psychologically, and socially as well. Our paradigm constantly is going to be biopsychosocial. Even that individual that you are helping wouldn't be whole as a person if those who are caring for them aren't actually whole as themselves. So very important is self-care before we could actually care. Even for us doctors, I think all of us, Rose having taken care of somebody who had cancer and passed on, all of us need to start with making sure we are in the best of care, physically, mentally, and socially.
Okay, thank you, Doc. Last two questions. Doc Vicki, this is for you. Now, a few industries are now more aware to be inclusive in the fashion industry. We see plus models joining the club of regular lean models. So how do you encourage women to appreciate their bodies, but at the same time offer liposuction?
Well, of course, we only exist really for people like me. So the reason I put up Belo Medical Group is because I was so insecure because I had really bad skin and I was fat. And when I see people, I couldn't look at them in the face because I thought they were looking at my bad skin. So I actually applaud people who are very self-confident, who are comfortable with what they are. By the way, Luis, there's a change now in beauty standards. For example, when I started, it was a lot of people wanted to be very thin. Now, no, they like to be a little malaman. It used to be breasts were the thing. Now it's butts. So when people say I'm very comfortable, I go, good for you. I wish I were like you, but I'm not. So for people who, sometimes if you just have one thing, I always say a millimeter scar on the face is a kilometer scar in the heart. And if you've been bullied like I was when I was young for being ugly or fat or whatever, and that's why I was adopted because I was so pangit, it really leaves a big mark. And I feel that it's improved my life so much that I'm more confident now. I can talk on a Zoom with 3,000 people watching because I'm no longer thinking, are they looking at how ugly my skin is? But I always do encourage, especially from the beginning with the color of our skin. I'm so happy to say that there are many, siguro before when I started practice, 80% would ask to be whiter. That was always the thing. Now 50% are very happy being morena. All they want is even skin tone, not different colors, but just one brown thing. So I see that's a really positive thing.
Last one for Julia. What's your skincare routine?
Ooh, Dr. Arabella would know.
But when you get home, buddy,
If you're
Sorry?
it's a must, diba? Na when you're done with taping, you wash your face right away. What are your musts talaga, the non-negotiables?
Okay, well, what are my non-negotiables? Well, I have these wipes. It's called the antibacterial wipes that are from Pond's. That's my first step, really. Like, that's how I clean my skin. And then I'll go in with a cleanser that's very gentle because I have sensitive skin. And then pads that are full of salicylic acid and glycolic acid to reduce acne and then renewal of my skin. And then I would go in with my sunscreen because it's very important.
Okay, well, thank you very much. Now, before we leave, do we have any final words for our viewers? We're starting with you, Miss Rose.
Oh no, I was gonna say something to Vicki. Vicki, do you still keep a stash of your chocolates in your clinic? I love going to visit Vicki because she had the nicest chocolates. Are you still indulging in that?
I think we may have a problem with Doc Vicky's connection.
She can't hear me. Okay, yes. My parting words is, health matters, as you say. Health costs. Don't for 1 minute think it's free. You gotta be prepared, and you gotta be discerning in your choice of doctors. Not all doctors are created equal. So you have to do your own research because at the end of the day, your destiny lies in your hands.
Thank you very much.
Thank you.
Ms. Rose. Doc Ed? Doc Ed, I think you're on mute.
There we go. Sorry. Yes, as I mentioned earlier, in this pandemic, what has happened is we lost a lot of our controls, and the objective is to rein in control so that we could, and that is by being more resilient, being more open to the different challenges, and see it in a way, we call it reframe it in such a way that we see the challenges as in fact opportunities where we could actually emerge from this even better than we were pre-pandemic. So hopefully stay resilient, all of us.
Thank you very much. Doc Vicki?
Well, I'm going to quote Scarlett. She just did something for Mega Magazine. And she said that we should all be kinder to each other, more loving, and help one another. And I think that would really help us to be outward centered a bit rather than, oh my God, this is so bad. So just, you can control your mind. So make it a positive and joyful mind.
Thank you very much. Julia?
Well, just many thanks, Manulife. Thank you for having me. And thank you to everybody who joined us for our webinar. Looking forward to the next one.
Maraming salamat sa lahat ng mga speakers natin. That was very insightful and helpful. Now, before we wrap up today's webinar, it's time to announce the winners of Medgate Philippines telemedicine vouchers. Flash on our screen right now. We have our 10 lucky winners. Congratulations! A Manulife representative will contact you on how to claim your prize. We'd like to thank everyone who joined us this afternoon for taking time and actively participating in our program. Watch out for more wellness webinars in the future. Now be sure to like and follow Manulife Philippines social media pages for the latest updates. Now we would like to hear your feedback on this afternoon's webinar. Simply scan the QR code on screen and answer our 2-minute survey. Thank you very much sa inyong lahat. As always, it has been a pleasure hosting for you, Manulife. I am Luis Manzano, and I leave you with this. Almost everyone can agree that COVID-19 pandemic has upturned lives. What you can do is prepare yourself to return to your normal routine and think of ways to be better equipped for whatever health issue might occur. Though you might not be able to tell when and what the next crisis may be, it is always best to be prepared by planning for the future. Sa inyong lahat, maraming salamat and stay safe.
You need a health plan that fits you better. Get Manulife Health Flex. Choose from 4 health bundles to get coverage for cancer, heart attack, stroke, and over 100 other critical illnesses.
Build it yourself to get just the right benefits, so you can start to make every day better in your own way. Find healthy that fits you perfectly. Ask your insurance advisor about it.